I'm good. How are you?
Doing well, doing well. So, welcome to the show today. So, what's going on in your world?
Uh, I've got the second generation iRefract, and Milbian told me I can't talk about the new device
What?
till April.
Oh, come on now.
We can stay on for 17 days.
Yeah, can't talk about it. Yeah, Milbian,
You,
you're being a real buzzkill.
you'll definitely hear about it though with Dr. Rasa. I think you're talking to her on the 24th, right?
Am I? I don't even. I guess I am. I don't know. I don't.
You
We do
you will
so
You
much
be.
with
ha
you guys.
I
Like,
know you guys have a lot. You have a
yeah,
lot going on, and this
yeah.
is a busy weekend.
Yeah,
So
so no, but I'm excited though to hear about it. So we'll keep our ears open, I guess, when we can finally talk about it. Because we've spoken a lot with you guys about iRefract over this past year, right? I mean, this was sort of the critical time for a system like iRefract because you can keep your distance, right, from patients. So pretty cool stuff.
exactly. Yeah. With the tablet, you can be farther away and, doctors are able to delegate, and then that gives them more time. Like Dr. Ross in particular, that's what she really likes about it is the fact that literally she's delegating all the data collection, and then she's actually just spending time talking to the patient, finding out what their real complaint is, and then spending time like if they need more medical, if they need advice on their glasses, contacts. And it shows in her reviews. I mean, I've seen them on like Yelp and Google and stuff like that. People talk about the technology, which it really surprised me. I didn't expect that, you
So
know?
yeah, Dr. Rossa in particular, I got to see if I can pull up one of her offices so people can see it. Uh, Let me pull it up here. So she's like the Energizer Bunny because she has set up, I don't even know how many offices at this point. She's running
She's
like
got
11 or 12.
13.
Oh my
She's
God.
13, up to 13. Yeah,
Yeah.
she opened like I think 4 last year, even during COVID.
Yep. So she is just out of control. I mean, let me actually put this up so people can see it. So her company, Big City Optical, all around Chicago. Now, Chicago is an incredibly competitive environment, right? This is
Yeah,
someplace that I would actually be very nervous about opening up cold in, despite the fact that there's so many people there, just because your competition is just killer. But what she's been able to do, I don't even know. She's done like what, 12 cold starts in like 3 years? I mean, something ridiculous, right?
yeah, exactly. Yeah,
And these are successful practices, and she's used the technology to sort of amplify her reach because she can actually like look at her data where she's across town, right?
exactly. Yeah, so like she did a cold start recently in Bucktown, which is an area in Chicago, because they all have their little names.
Trendy,
And so
trendy area. I remember Bucktown, so
yes,
trendy. Yes.
yeah, very trendy.
Yep.
And I mean, it's the 20, 30, 40 somethings that are coming into our office, and they're very, tech savvy and they sit down in front of the iRefract and they actually, notice it and they're like, this is new, this is cool, and they get their glasses. And I mean, her remake rate has gone down, which is great, for an eye doctor, the less remakes, the better. So
Yep. And
yeah, there you see the list of Bucktown, Broadway,
yep.
they all have the iRefracts. So it's really cool. Like I'm headed down there Monday. They got some new hires and I'm gonna go down to the Broadway location and actually train them on Monday.
Oh,
So
cool.
yeah.
Excellent.
So what does she do? She, can you go through the mechanics of what she does? How can she run 12 offices? Does she have, how many optometrists should she have hired? In
Actually,
the
I
12?
think I want to say she has 7 ODs,
Yep.
including herself. And what she does, like in particular the Bucktown, she'll open that office, and because there's only like maybe 4 appointments, the first day, she'll literally be in another office where she has a full schedule, and she'll remote in on a HIPAA compliant Zoom and go over with the patient, because she has a couple of our devices and it shows them the anterior segment because we've got our 100 series, which does wavefront and Scheimpflug and Placido ring topography, NCT, and it takes an external photo. So she has all that data, and then she has the eye refract, which gives her refractions, it gives her pupils, day and night refractions, and then she talks to the patient. And as long as there's no issues, she'll go ahead and give them their glasses and contacts, and then they just stop back by to pick them up. And then if there is something that she sees, then she'll schedule them to come in another time back to the Bucktown office when she's there and dilate them if there's something that needs to be addressed.
So she'll
So
write a prescription online?
she will, yeah.
Melissa, she
Excellent.
has to be, obviously has to have a well-trained staff to do it remotely. Do you help her train these staff or does she do it herself?
I do. I go in, like I told you, Monday, she's got some new hires, so I'm going to go in. And then she's also got a technician, Ava, who's actually, I believe, going to optometry school come this fall.
Oh,
And so
excellent.
she's kind of like helping me train the staff in those locations, because when I can't be there, she's there, and she obviously understands quite well what the eye refract is doing. So between them and then of course, Ratha, she's an expert and a great refractionist. So and her staff has done really well with it. I think they like it because it gives them more ownership of what's going on.
Right. Like another doctor told us yesterday, different company with different equipment. He doesn't know how to turn it on at this point, and everybody staff does. Probably similar with yours.
Exactly. Yeah. And so I mean, and her staff, if they run into problems, they have my number, they just reach out, and I help them get back on track,
Yeah.
and then they're able
One
to
thing
work.
I noticed that is not advertised, and any of us that were in practice for many, many years before all this automation, we used to stand over patients. And in very short order, we all had lower back aches. That was a disease in optometry. Everyone had
Exactly.
backaches. And this eliminates backaches, but yet it doesn't, I never see it in the commercials with an
Well,
optometrist holding his lower back.
well, and that's like me. I mean, I'm a refractionist. I came from a big cataract and LASIK practice, and I refracted, and I have repetitive motion injury from doing which is better one or two myself. It's my shoulders, not my back. But yeah, I totally understand that. We actually did a campaign on LinkedIn about that because you're right. Your back or your shoulders get messed up from doing that over years and years and years.
Yep. I think the chiropractors sued them, so they can't say that.
I believe that. Yeah.
Well, it's funny. I
So-
mean, in the future, I'm sure a lot of ODs won't even know what you're talking about, right? Because what we have now, what this is going to be, is like going to be the standard, right? This is the way younger people are going to know how to do this, right?
Exactly. Well, and I mean, you're on our webpage. I mean, we've also got our VX65, which is a digital four-opter, and it also works off of a tablet. So, I mean, even if you still want to do the refractions yourself as an OD, I mean, you're still going to be able to do it on a tablet versus having to put your arm up, So you're right. They won't have those same issues.
I used to go out to give motivational speeches to optometrists, and one was sponsored by a company that was selling devices that were eliminated optometrists from doing a lot of the work using automated equipment. I began the lecture saying, what sort of crime would you have to commit to get a sentence of 30 years to life, being locked in a dark room, saying better one or two? Your whole life. And not only that, but you end up during that life having backaches and shoulder aches. What kind of crime is that?
I know.
And then I went on to say, here's how you eliminate this sentence, so.
Well, and that's like, we don't want to take the art of refraction away from the ODs. I mean, let's face it, the eye refract is still a four-opter. I mean, and the majority of patients will go through it just fine, but there's still patients that are going to have to go to the OD because, they have ptosis, or they have, a severe cataract and they can't go through the eye refract. So you're still going to be practicing. You'll just get to do all the challenging ones.
But it's remarkable how many don't know how to use a retinoscope.
Right.
Or a direct ophthalmoscope.
Right. Well,
I don't know if they train them in school anymore.
They do, because I will tell you, the schools don't want our eye refract simply because they do want the ODs to come out and know how to use all that stuff. I mean, it's great. I mean, they may get to see our eye refract, and they may get to see digital four-opters, but they do still want them to have the art of refraction. So, and I like that. I think they should, don't you?
I don't know, Steve. I don't know when you were in school, did they still teach you the art of lens neutralization, to be able to find out the power of a lens using another lens?
Sure.
If you didn't have a
that was
lensometer?
part of ophthalmic optics. We all stood in the back of the classroom, and I don't think it was ever on the test, but yes, the moving back and forth, the angles and stuff. So we learned that.
And you would neutralize it with a known lens.
And I
to get
probably
the
could still do
power
it to this day.
because you didn't have a lensometer.
And there are other environments where it just doesn't work. If somebody's in a nursing home or some other facility that just doesn't have the high tech, you have to go back to your knives and bearskins to get as much information as possible. So I think there always will be a place for it.
Exactly. Oh, and speaking of lens meters, I know Adam knows about this. We have the VX40 lens meter. It is also wavefront. It is
Hmm.
literally one button. So if you're hiring a brand new tech who's never worked in, optometry, they literally put the glasses on, push one button, and you get accurate readings on a pair of glasses every time, which
Even
is great.
Yeah.
even
It
prism
does
and stuff.
prism, yeah. So it's
Yeah.
pretty cool because, a lot of times that's what, and I mean, right now, nowadays, there's such a tech crunch getting techs to stay, you know? So it helps the easier that, or at least that's how I feel. The easier that I can make it for you guys, so your techs can do the things that you need them to do, the better it is, right?
Yeah, absolutely.
The challenge is, I'm sure everything goes very seamlessly into EHRs, electronic health records, your stuff.
It
It's when you
does.
have a multiple office and the internet goes down that you feel like a prison of technology, but hopefully it's not going to happen as often as it did way back in the past.
Yeah, I don't know that I've had that problem with Dr. Rasa and her big city opticals, but it's what I tell people if that happens. I mean, we all have our cell phones now. Take a picture, and then if you need to, you can import it into the EMR when it's back up.
Yep. And in terms of reliability, you guys were telling me a story about the tablets, right? Those are just bog standard Samsung tablets, right?
They
So if
are,
you screw
yeah.
them up, which will happen, right? People drop stuff all the time. It's real easy just to replace them and get back up and running.
Exactly. And you can buy one off of Amazon or you can reach out to us because we can, since we've already got the software on there, we can just ship one out. Or like if it's big city, which is right here local, any of my Chicago doctors, they may stop by our office or I may run out to them.
Right. I mean, these things are so cheap too. You may just want to keep a few spares lying around, right? Put them in the back room, and if you need a tablet, whip it out, right?
I think that's what Jordan Jones said that time he
Yeah.
talked to you.
Yep.
Yeah, that's what he
Yeah.
does.
So it's worth it to prevent any downtime.
Exactly.
So
And I'm
what's
sure
behind you? I looked at it. What's your background there? It looks,
Oh,
the
one of my
screen.
friends is an artist, and this is a painting that she did. It's
Is it
called Brain
not?
Traffic.
It's
Okay.
probably the coolest Zoom background I've ever seen.
Well,
I'm in
thank
my
you.
Yankee room, by the way. I'll move my thing so now you can see my background.
Oh, I like
Boo.
that. Very cool.
Thumbs down. Thumbs
Okay.
down, says the guy in the Mets hat. So, uh, oh my goodness. Well, Melissa, thanks for being here again today, and thank you for sponsoring the conference. It's been going really well, and I know we're going to be working together a lot over the next, I don't even know how many months. Right? We have a bunch of webinars coming up and other fun stuff, so it should be good.
We do. I look forward to it. Thank you.
All right, have fun in
Thank you,
Chicago.
It's been
Melissa.
great.
Thanks. Bye.
Bye now.